For the last 21 years, Arkansas Support Network has been changing the lives of children with special needs and their families here in Northwest Arkansas. This nonprofit was started by a small group of parents and volunteers who wanted to provide support and assistance to these families with the belief that every person has the right to live in a home and in the community as an active and accepted member. Tonight, we are joined by Keith Vire, the CEO of ASN. Keith, welcome to the show.
Thank you very much.
Tell us what led to the creation of ASN.
Well, that's a really interesting question. In 1988, and I guess in 1987, there were a group of moms, 5 moms who had young children with developmental disabilities. And those moms sort of looked at the landscape of the traditional services that were available for kids with disabilities at that time and just said, we want to have something different for our kids when they grow up. And so together, those 5 moms and one really dedicated staff person started to look at what was available around the country. They went to visit places in the north and came back and started our program, which was then called Family Support Services. And the program was a family support program, which just instead of providing supports in a traditional way, said to families, tell us what your needs are, and let's see if together we can figure out a way to help you.
So far, what would you say have been some of the biggest challenges that these families, their children, have had to face?
Well, I think one of the biggest, it sort of goes in stages. When a family first learns that they have a child with a disability, often there's a great kind of emotional transition that goes on, and that's obviously very difficult. It's one of the things that we're able to help with because we have other families who have been through that same transition, and they're able to say to those families who are new parents, you know what, it's going to be okay. That's the first thing. But I think as the kids get older, one of the biggest problems that parents face is financial.
Absolutely.
In many cases, one parent has to stay home because there are not services available. And so the financial impact on the family is just pretty tremendous.
I can't imagine. What are some of the disabilities that these patients, these people and families have?
We provide supports primarily to folks who have developmental disabilities, which means in Arkansas, that definition is autism, cerebral palsy, epilepsy, and mental retardation. Those are the 4 developmental disabilities. And so most of the people that we support have one of those diagnosing conditions, and many of them have, in addition, a mental health diagnosis. In our business, what people call dual diagnosis. They have mental health issues and they have a developmental disability.
And it seems that most of these disabilities require 24/7 care. Is that right?
Well, depending on the level of support or the level of the severity of the disability, some of the people that we support need a minimal amount of care. Others do need. We support people in our program who are ventilator dependent and who have oxygen around the clock, and so obviously, and are tube fed. So obviously, those folks do need 24-hour supports, but some people don't need nearly as much.
Tell us about some of the services that your program offers.
We have a sort of a continuum of services. We try to provide services. I think one of the things that we miss in our business sometimes is that it's almost as bad to over-support a family or an individual than it is to under-support. And so we try to work with a family to find that balance, the amount of support they need to be able to have a quality life without over-supporting, so that we're just wasting resources and creating dependency.
Right.
So the first thing we have is our family support program, which was our original program, and that's a program that provides a little bit of cash assistance to families, very, very flexible, and then an awful lot of moral support, support groups for parents and those kinds of things. At the other end of the scale, we have our supported living program, where we have people who would otherwise live in an institution, and we provide whatever support they need to help them live in the community, in an apartment, in their own home. We have about 185 or 190 people in that part of the program. Wow. So we go from our family support program, which is a lot of support, moral support, that kind of thing, but not direct support in the home, to the other end of the scale, where we have 365 days, 24 hours a day support.
That's just amazing. Over the past 21 years, how many people would you say you have served? Do you have any idea?
We support right now about 750 or 800 families a year in all of the different programs that we provide. And I've been doing this for 32 years now. I had a previous job in Northwest Arkansas supporting people with disabilities. I really just could not even begin to count the number of people that I've worked with. I do know that I see those people pretty much in the community everywhere I go, and I have friends from 1977 forward that I count dear to me. Some of the families that I support, that our agency supports, I've known those family members for 35 years now, and I love them like my own family.
Now, there are different ways to support ASN. Tell me about the Starfish Gallery, Keith.
Okay. Starfish Gallery is a little an eBay, basically, an internet sales program that we started. It employs one person who has a disability, and she is able to manage all of these things that are donated to us, and then we advertise them and sell them. It provides livelihood for her and some public awareness, because that's all over our website, and it sort of helps spread the word in addition to raising a little bit of money.
Excellent. Now, there's a scholarship that you're awarded each year. Tell me about that.
In 1988, when our program was started, one of our founders was a lady named Pam Bijo, and Pam was just a wonderful mentor, teacher, advocate, support for many, many families and individuals who have disabilities over the years. Pam passed away in about 1997, I believe, and was a great friend to all of us, just a wonderful example of servant leadership, a great person, honestly a great person. And so after Pam passed away, our board created the Pam Bijo Memorial Scholarship in her name. And every year we make at least one scholarship, sometimes as many as 3, to folks who have decided to spend their lives trying to make the world better for people with disabilities. It doesn't have to be a college scholarship. It could be some sort of a training program, even a conference that folks might go to that they think will help them. All we want to do is to further Pam's legacy, which was to prove that people with disabilities can live in the community and be a part of the community.
That's just wonderful. You've got a big event coming up, a youth run. Is that correct?
Actually, we have several big events coming up. But in May 2nd, we have our Safety Matters Youth Run, which is a new event for us. This is our 2nd year. And we've done that in partnership with another nonprofit called Let's Bring Them Home, which is to help find missing children and adults, whether or not they have disabilities. But this Safety Matters program it's a training curriculum to help people be safe, and it's just a great program. We have a 5K run. We have trout fishing in America that will be playing in the afternoon. It's going to be at the Northwest Arkansas Mall. It's just going to be a fun event. All
right, I'll have to try to be there. Keith, tell us, what does the Starfish logo represent?
Okay. There's a great story, and in fact it's on all of our newsletters and brochures and everything, the story of the starfish, which did not originate with us, although we've used it for so long now that we get emails from people all the time asking if our permission to use the story. We did not make it up, so we just tell people we have no ownership of that. But it's about a young man walking on the beach, and in the distance he sees coming towards him an old man who occasionally just leans over and picks up a starfish and throws it back into the sea. And as they get closer, he sees the old man do this many, many times. And when they meet, he says to the man, why do you do that? There are so many starfish on the beach, you can't possibly make a difference. Yeah. And so the guy picks up one, throws it into the sea, and says, it made a difference to that one.
That's beautiful.
It is a beautiful story, and really that sort of has sustained us all these years. We may not change the world, politically. We may not make a huge impact on society, but for the people we support, we can definitely make an impact.
I agree with that. For our viewers at home who want more information about the Arkansas Support Network, there's a website. Can you tell us what that website is?
Supports.org. And if you go there, you'll find all kinds of information about our different programs. My email address is there. All of our phone numbers and contact information is there. And you can also just find, actually you can see our board members. There's lots of information there about our events and the things that we've been up to.
Excellent. Well, Keith, thank you so much for being here. We're very fortunate to have ASN here in Northwest Arkansas.
Thank you very much for having me.
All right. Family Health Today. We'll be right back.